Hello?
Hello, Kelly. This is Dad. Your mother's having trouble with her eyes.
Wait a minute, slow down.
She can't read the newspaper, having a lot of difficulty. We've taken her to an eye doctor, and they want to give her shots in her eyes. They're recommended to go to a specialist. I just don't know what to do here.
I don't understand anything I've been reading, and I sure can't explain this to my parents. All I can find is stuff that's sending me to big drug companies and university websites and words that I don't even understand. There has to be somebody that can help us get from A to B. Hey Michelle, this is Kelly. Do you have a minute?
Sure.
My mom was just diagnosed with macular degeneration, and I've been on the computer for over 2 hours. I'm trying to find something that I understand, and I don't understand any of it. I don't even know that I can trust what I've read. Do you know anything about it?
Yeah. You know what? It's not as uncommon as you might think. Let me do this. My husband went to school with an ophthalmologist. So let me get his information for you and call you back, and we'll get you squared away. Oh, of course. No worries. Of course. Yep. I'll call you back as soon as I have that. Bye.
It would be great if you could always consult an expert with a quick phone call. Unless you subscribe to a concierge medical plan that's probably the exception to the rule, while a particular diagnosis may be completely foreign to a patient and anyone thrust into the role of caregiver, chances are many people have already faced that exact situation. What you need is a navigator to help you get efficiently from where you are to where you need to be for best outcomes. I'm Tom. It's my privilege to be your navigator in this discovery module from VisuQuest. I want to introduce you to this very common condition called age-related macular degeneration. Let's just call it AMD. Before we get going, we'll try to follow a couple of ground rules. Let's avoid medical jargon that's difficult to understand. We'll introduce you to some of the basic language of retina important for understanding AMD. No lengthy presentations. Some topics can be summarized in short order. Others require a little more time to cover correctly. We'll be sure to examine basic eye anatomy so that we know exactly where we are. We'll show you easy to understand illustrations of wet versus dry macular disease. We'll visit with real patients to explore common questions. And we'll not forget to explore the more common misconceptions. Finally, we'll give you plenty of helpful resources and references. Okay, let's get started. Here's Dr. C. Joseph Beck, a board-certified ophthalmologist and fellowship-trained retinal specialist.
Hi everyone. You know, I often hear patients confuse the word macula with a disease. Well, that's like saying knee means bursitis or arthritis. So what they mean, of course, is degeneration of the macula. And a great way to explain degeneration is to imagine replacing a highly specialized body part with a scar or a callus. Some interesting and important facts. Most people have heard there are two types of AMD, dry and wet. What they don't commonly know is that essentially all eyes start with dry change. A percentage later convert to the wet category. And before you tell yourself you don't understand, let me assure you we'll get you comfortable with this all too common disease called AMD. Remember in our definition of degeneration, we talked about replacing specialized cells with material less functional. Well, just imagine replacing topsoil with rocks or tennis balls, anything less helpful to the overlying grass. Likewise, the retina loses function when its supportive pigment layer is disturbed. Well, here's the real thing. This is a color fundus photo of a patient's left eye, and you can see the creamy, yellowish drusen under the macula. When I consider wet AMD, I like to think of a weed barrier damaged by UV light. Stuff I'd like to remain under my topsoil, especially rogue weeds, now mixes with the desired vegetation on top. Visual distortion caused by drusen under the macula is variable, from basically none to moderate. Wet AMD is exponentially worse. You know, every expert started as a student, and the best experts know they are still students. Well, I'd like to share what we've learned over the last 20 years of subspecialty retina practice. And we want to build on this tutorial with periodic updates based on observations and suggestions submitted by you. Well, to get us efficiently through the topic of age-related macular degeneration, I'd like to walk you through a series of high-value modules. These include a look at dry versus wet AMD with helpful custom animations, a review of the common testing procedures that make accurate, individualized care possible, an easy-to-understand presentation on VEGF, vascular endothelial growth factor, the fuel that drives wet disease, a review of both alternative and combination treatment options, a discussion on maintenance therapy versus what is called treat and extend, a review of common eye conditions that often accompany AMD, a helpful interview with a highly experienced low-vision specialty optometrist, in-depth interviews with leading doctors in optometry and ophthalmology, and a thoughtful presentation on the psychologic aspects of chronic disease and important tools proven to make a positive difference for patients and caregivers. And finally, what you really want to know but are unlikely to get from a typical clinic encounter.
It was the time between when my optometrist referred me to a retinal specialist and the consultation that my anxiety level really peaked. But once I understood what my treatment options were, I felt that I was on the right track and I regained hope.
I think everyone overreacts initially. I don't know who was more afraid, my dad or me. The problem is a lack of understanding and, unfortunately, misconceptions. Dealing with AMD is not a sprint. It's really best described as a marathon.
Okay, we're at A. Now we need to get to B. Our team is identified and in place. Now we need to know what to expect. Don't expend valuable time recreating the wheel. Get coached up by others who have already navigated the course from diagnosis to best outcomes. We hope you found this introductory module helpful in understanding the basics of age-related macular degeneration. In just a moment, you'll see a list of helpful web-based resources on AMD and a list of recent major clinical trials. If you'd like a much more in-depth tool to help you get from A, diagnosis, to B, best outcomes, I encourage you to consider VisuQuest's new 10-module comprehensive series on this all-too-common eye disease. Learn all you can, whether you find yourself the patient or a caregiver. Take an active role. Reach out to others who have navigated the same route. And don't forget, there's hope in knowledge.